Ear pain, or otalgia, is one of the most common complaints when presenting to a doctor's office. Often the pain is due to an ear infection. But what if the ear exam is normal with no obvious problem of the ear canal or eardrum seen? In such situations, the pain likely is being triggered from non-ear locations, which the ear shares common neural pathways. About 2/3 of such referred ear pain ends up being due to some type of regional musculoskeletal issue, whether stemming from the neck or jaw joint. Another 15% is found to be due to a tonsil or back of tongue problem. Here are some simple maneuvers that may help localize where the ear pain is coming from. To evaluate possible jaw joint or TMJ trigger for ear pain, firmly palpate the jaw joint and have the patient open and close the mouth. Be sure to evaluate not only the lateral jaw joint, but also the posterior aspect of the joint by feeling for the groove between the jaw joint and the ear while the jaw is being opened and closed. Also, stick a finger into the ear canal and press forward while the jaw is being opened and closed. TMJ as the cause of ear pain will be verified if any of these maneuvers trigger or exacerbate the ear pain. To evaluate cervical neck causes of ear pain, there are two main regions to check out. First is the attachment of the SCM or sternocleidomastoid muscle to the mastoid bone tip. Have the patient turn the head and look up. Feel for the mastoid bone and move the finger downwards 1 to 2 inches below the bone. This is where the SCM tendon is located. Firmly press into this region, and if it triggers or exacerbates the problem in ear pain, tendinitis or muscle spasms of the SCM is the cause of the otalgia. Next, check out the rest of the neck feeling for any unusual lumps or bumps. Specifically, be sure to also evaluate the posterior neck by pressing firmly on the muscle just off the midline. Ear pain triggered by paraspinal muscle palpitation does suggest nerve impingement of the cervical spine as the cause of the otalgia. In order to evaluate the tonsil and back of the tongue, visually look in the mouth. If all looks okay, stick a finger into the mouth and firmly press into the tonsil and back of the tongue regions in a quick sweeping motion. A normal gag will almost certainly occur, but the main information needed is whether the ear pain was triggered or exacerbated. Also, when feeling the tonsil and tongue with the finger, be alert for the presence of any unusual hard and tender knot, which may be due to a submucosal infection or cancer. If none of these maneuvers elicit ear pain, you may have to see an ENT specialist for further testing to try and figure out where the pain is coming from before proper and successful treatment can be pursued.